the nurse. Here we are discussing about staff nurse exam questions and answers 2022. That most repeated questions, that those were asked, most repeated questions asked during each and every government nursing exams. If you are not subscribed our channel, please subscribe. So we will go to our topic, staff nurse exam questions and answers. Staff nurse exam questions and answers 2022. Please subscribe our channel, the nurse channel. First question. Complications of intravenous infusions includes or except circulatory overload, infiltration, air embolism, dehydration. Correct answer, dehydration. Because if you are infusing so much fluids into intravenously, it will leads to circulatory overload. Infiltration also, it will leads to it is caused by infiltrating IV fluids into the neighboring tissues. It will leads to local edema and pain. Air embolism also, it is due to while accidentally we are through IV set, the air will go inside the vein and it will leads to air embolism. Air will move through the blood. And dehydration is actually indication for intravenous, one of the indication for intravenous infusion. That is not a complication of intravenous infusion. Next question. Which area is also known as blind spot? Which area is also known as blind spot? Macula, lutea, Fovea centralis, optic disc, cones. Correct answer, optic disc. Optic disc is also known as blind spot because there is no cones or rods cells that are photosensitive cells that is situated in retina of the eye. In optic disc, these photoreceptors are not there. So it is known as blind spot. Macula lutea, that is a central point of the retina, posterior retina, and it gives a clear vision. In the center of macula lutea, there is concentrated the photoreceptors called cones. So it will gives a clear picture or clear vision. That central point of macula lutea is known as fovea centralis. This cones photoreceptors helps for color vision. There is another photoreceptors. There is that is rods. Rods helps in black and white vision or dim light vision. So I will demonstrate you. This is a image of the eye. Here this is optical disc that where optic nerve is starting. Here there is no rods or cone photoreceptors. That is why it is known as blind spot. This is the area of macula lutea. In the center of the macula lutea, it is known as fovea centralis, where there is cones photoreceptors are highly packed. So it is a area where there is clear images can see. Fovea centralis. Next question. Universal immunization program was started in. Universal immunization program was started in 1947, 1978, 1985, 1992. Correct answer is 1985. Universal immunization program was started in 1985. Next question. Red Cross Society was founded by. Red Cross Society was founded by Henry Ford, Henry Dunant, Henry Browen, Henry Clyde. Correct answer, Henry Dunant. Next question. In following, which disease is caused by Varicella zoster? In following, which disease is caused by Varicella zoster? Diphtheria, smallpox, syphilis, chickenpox. Correct answer, chickenpox. Chickenpox is caused by Varicella zoster virus. Diphtheria is caused by Corynebacterium diphtheriae, that is viral disease. Smallpox is a viral disease caused by variola virus. Syphilis is caused by Treponema pallidum. So I think it is clear. Diphtheria caused by Corynebacterium diphtheriae. Smallpox is caused by variola virus. Syphilis is caused by Treponema pallidum. Chickenpox is caused by Varicella zoster. Next question. Which fluid is used for the dilution of BCG vaccine? Which fluid is used for the dilution of BCG vaccine? Tap water, distilled water, normal saline, ringer lactate. Correct answer, normal saline. Normal saline is used for mixing a BCG vaccine. It will come as a powdered powder form. Then it will mix with normal saline and we can administer. Next question. When authority flows directly from superior to a subordinate, it is termed as. When authority flows directly from superior to subordinate, it is termed as functional authority, line authority, line and staff authority, staff authority. Correct answer, line authority. Line authority means when authority flows directly from superior to subordinates. Next question. Administration of ready-made antibody creates. Administration of ready-made antibody creates active acquired immunity, passive acquired immunity, active natural immunity, passive natural immunity. Administration of ready-made antibody. Correct answer, option B. Because here the immunity given by antibody which are created outside the body. If it is actively created inside the body, it is known as active. Here the ready-made antibody administered. The ready-made antibody is created outside and administered to that person. Because of that, it is known as passive immunity, passive acquired. Because after creating the antibodies outside, it is administered to the person. That is why it is known as passive acquired immunity. In active acquired immunity means it is the antibodies are acquired. The means after a infection, the body actively produces the antibodies. Then it is known as active acquired immunity. Active acquired immunity means that it is similar to active natural immunity. Active acquired immunity we can make from the vaccines, live attenuated vaccines or killed vaccines. When administering these killed or live attenuated vaccines, the body actively makes antibodies against it, and the body have immunity against that particular disease. In that case, it is known as active acquired immunity. If it is getting from any after the exposure of a clinical or subclinical infection, then it is called active natural immunity. After administering killed or live attenuated vaccines, the body produces antibodies, then it is called active acquired immunity. When it is the antibodies are created active after clinical or subclinical infections, it is known as active natural immunity. Passive natural immunity, in the sense passive, then body is not creating antibodies, it is created from outside. So from mother, the antibodies are created, then it is given to the child or given to the baby through natural way, that is through placenta or breast milk. Then baby is getting immunity. That is known as passive natural immunity. Example. So I think it is clear. Administration of ready-made antibody that creates passive acquired immunity. Next question. Which of the following is the patient clinical record? Which of the following is the patient clinical record? Intake and output chart, duty chart of staff nurse, stock register, staff performance record. Which of the following is an example of clinical record? So most of you know this is easy question. Correct answer is intake and output chart. This chart is belongs to a patient case file, and all others are administrative files only. Duty chart of staff nurse, stock register, staff performance record. These are the administrative records, and this intake and output chart belongs to patient case file, patient clinical record. Next question, 10th question. Which of the following disease is not transmitted by airborne droplets? Which of the following disease is not transported by airborne droplets? Measles, chickenpox, poliomyelitis, tuberculosis. Correct answer here, poliomyelitis. Poliomyelitis is not transmitted through airborne droplets because it is transmitted by fecal-oral route. And measles, chickenpox, tuberculosis are transmitted through airborne droplets. Poliomyelitis is transmitted through fecal-oral route. Next question. In following, which organ is known as windpipe? In following, which organ is known as windpipe? Options: larynx, trachea, lung, bronchi. So I think this is also easy question. Correct answer is trachea. This question is asked during so many exams, so it is a repeated question. Don't make a mistake here. Correct answer is trachea. Trachea is known as windpipe. Next question. Amoebic dysentery is caused by. Amoebic dysentery is caused by Giardia lamblia, Amoeba proteus, Entamoeba histolytica, Taenia solium. Amoebic dysentery is caused by option C, that is Entamoeba histolytica. Giardia lamblia causes giardiasis, Amoeba proteus causes amoebiasis, Taenia solium causes cystic sarcosis. I think clear. Giardia lamblia causes giardiasis, Amoeba proteus causes amoebiasis, Entamoeba histolytica causes amoebic dysentery, and Taenia solium causes cystic sarcosis. 13th question. The typhoid fever is an example of. Typhoid fever is an example of bacterial disease, skin disease, parasitic disease, viral disease. Typhoid fever is an example of bacterial disease, and the bacteria Salmonella typhi causes typhoid fever. Typhoid fever is an example of bacterial disease. The bacteria Salmonella typhi causes typhoid fever. Next question. The somatosensory area of cerebral cortex is found in. The somatosensory area of cerebral cortex is found in frontal lobe, temporal lobe, parietal lobe, occipital lobe. Correct answer is parietal lobe. Somatosensory area of cerebral cortex is found in parietal lobe. Motor sensory cortex is found in frontal lobe. Temporal lobe mainly for hearing and all. Occipital lobe for vision. Next question. Vomiting should not be induced in the treatment of. Vomiting should not be induced in the treatment of atropine poisoning, paracetamol poisoning, warfarin overdose, poisoning with corrosives. Vomiting should not be induced in the treatment of mainly first aid. So correct answer is poisoning with corrosives. Corrosive means acids and alkalis. And in the case of accidental intake of acids and alkalis, the nurse should not induce vomiting because it will cause further damage to the upper GI tract and mouth. So in the case of poisoning with corrosives, that is acids and alkalis, the first aider should not induce vomiting. 16th question. Presence of pathogenic bacteria in blood is known as. Presence of pathogenic bacteria in blood is known as toxemia, septicemia, bacteremia, all of these. It is a confusing question, but it is important. So correct answer is option C, bacteremia. Here the presence only, the pathogenic bacteria presence in the blood only, that is known as a bacteremia. If the pathogenic bacteria causes infection, the presence of pathogenic bacteria and it causes an infection, then it is known as septicemia. So I think the difference you understand. If only the presence in the blood, that is known as bacteremia, but the presence of pathogenic bacteria and it causes infection, then it is known as septicemia. Toxemia means it is a general term. The toxins, the bacterial toxins present in blood, then it is known as toxemia. In septic shock and all, toxemia may be there. Along with the septicemia, toxemia also will be there. Some microorganisms produce toxic substances into blood. So that will cause toxemia. So toxemia, septicemia, bacteremia. The difference you should understand. Bacteremia means simple, the presence of pathogenic bacteria in the blood. And if it is causing infection, it is known as septicemia. If the bacterial toxins present in the blood, it is known as toxemia. So next question. Planned educational activities provided during in a job. Planned educational activities provided during in a job. Continuing education, job description, job analysis, and in-service education. Planned educational activities provided during in a job. Most of you make correct answer only. That is option D. In-service education. Planned educational activities provided during in a job, that is in-service education. 18th question. Toxicity of the which antitubercular drug can cause 8th cranial nerve damage? Toxicity of which antitubercular drug can cause 8th cranial nerve damage? 8th cranial nerve is vestibulocochlear nerve, and it helps to hearing. Options: streptomycin, isoniazid, rifampicin, ethambutol. Correct answer is option A, that is streptomycin. Streptomycin causes 8th cranial nerve damage if it is in toxic level. 19th question. It is an easy question, I think. Most common complication of spinal anesthesia. Most common complication of spinal anesthesia. Options: anorexia, hypotension, mental confusion, hypertension. Sorry, the correct answer is hypertension. Hypertension is the most common complication of spinal anesthesia. Last question. During delivery, visible movement of the head of baby due to twisting of the neck sustained during internal rotation is termed as. During the delivery, visible movement of the head of the baby due to twisting of the neck sustained during internal rotation is termed as extension, restitution, expulsion, crowning of the head. So all of you know, during delivery, the delivering part should be in a anterior-posterior diameter. Then only delivery is possible. So after the delivery of head, the next part is shoulder delivery. So shoulder will come into the anterior-posterior diameter of the pelvis. So that time there will be a slight internal rotation of the shoulder will be there. So that time the neck will be twisted. So in order to make it normal, there will be external rotation of the head. So that process is known as restitution. During the delivery, visible movement of the head of baby due to twisting of the neck sustained during internal rotation is termed as. That is restitution. So we have discussed today 20 questions, 20 easy questions that are repeated in each and every government exams. So it will be helpful for preparing upcoming exams in 2022 also, and those who are preparing for Kerala PSC DME exams, these questions may be helpful for them. So best wishes and prepare well. We will come with another important questions. So stay tuned. Best wishes. Thank you.